Let's talk about toothbrushing for just a minute. With toothbrushing, it's all about the actual toothbrush bristles. Soft bristles are what we're looking for. The rest is all about personal preference. Do you like a handle that's thin or fat or has bends in it? That's all whatever's most comfortable in your hand. But the important part is the soft bristles. Medium and hard, you can use those to clean your bathroom, but it has to be a soft bristled brush that goes in the mouth. And as far as toothpaste goes, that too is personal preference. If you have a client who doesn't care for paste at all, don't use it. It's not worth it. Toothpaste is basically just deodorant for the mouth, so it may have some fluoride in it. Just find a flavor that they like, and if they don't, just skip it entirely. Not a problem either way. With toothbrushing, it's going to take a long time. It's about 2 minutes to get the mouth effectively clean. I'm going to use a mouth model for you today. So for all of us that are directly brushing our clients' teeth, we want to put gloves on, and we want to come from behind our clients. What I like to do is have them in a seated position whenever possible. You can do it in the bathroom. They can sit on a chair. They could sit on the toilet, and you could be coming from behind them. You want to be able to rest their body up against you. That adds a lot of stability. So if they're here and I'm leaning down into them, I have an excellent field of vision, so I can see everything that's going on in the mouth. Okay, so if this is their mouth, you want to have them open. You're going to brush the biting surfaces first. I always start in the upper right and work my way all the way around. By starting in the upper right, you're going to be able to make 3 complete circles. You'll always know exactly where you were. Once the biting surfaces are done, they can close down and get a little bit more comfortable, and you're going to start again in the upper right. You're going to go on the outer surfaces, the parts that you see when they smile. You're going to tilt the soft toothbrush up into the gums, and you're going to make little circles. All the way around, do all the top teeth, then all the bottom teeth. Again, angling that soft toothbrush into the gum line. All the way around. The next part is the inside, the parts by the tongue. You're going to have them open wide, and you're going to again angle the toothbrush bristles towards the gums. When you get to the front teeth, the toothbrush isn't going to fit, as you can see, if you don't go straight up and down. So for the front teeth, we go straight up and down, about 10 times on each individual tooth, and then back towards the gums. So again, the front teeth, straight up and down. Can you see that? It goes straight up and down, and then towards the gums. Now before I finish, I also like to brush the tongue. There's a lot of bacteria that stays on the tongue. And then if they can spit into the sink. But again, when you're brushing their teeth, you always want to have yourself behind them whenever possible. If your client is in a wheelchair, it's the same thing. You want to be behind them and leaning in. If you're coming at someone from a forward-facing position, it's almost like a weapon. It's like a jabbing motion towards them, and they don't have as much control about how far back the toothbrush is going. So again, for their comfort and for your safety with them being behind and rest against you, you want to come from behind and cup their body and their head against you. Toothbrushing should take about 2 minutes. There's all different timers that you can use. Try to keep it really simple. If they like toothpaste, great. If not, that's okay too. It's the mechanical action of using the soft toothbrush to remove the plaque.